Prateik Poddar, consultant gastroenterologist and liver specialist from Kolkata. Today I am discussing about hepatitis. What is hepatitis? Hepatitis, hepa and itis. Hepa means liver and itis means inflammation of the liver. So in hepatitis, there is basically inflammation and in real terms, in basic terms, damage of the liver. When there is damage for the liver, this can be because of so many other causes like viral hepatitis, alcohol-induced hepatitis, fatty liver-induced hepatitis, and sometimes even drug-induced and other rare forms of hepatitis, which I'll be touching upon later. Now, hepatitis in itself causes damage to the liver. This can cause problems in liver function and ultimately can result in liver failure or even liver cirrhosis, which can turn into liver cancer. Now, why is this so important? Our liver is a very essential organ of the body and it works to perform various functions which help in healthy living. It purifies the blood, it manufactures very important components like proteins, it manufactures immunity building substances, and it builds the structure of the body and it prevents against infections as well as builds the entire body to restructure and improve the body function. Now this is affected whenever there is damage to the liver. So due to any cause, if there is liver injury, what happens is ultimately these functions keep stopping and the patient can develop complications and a person can have increased mortality and even difficulties because of this kind of damage. Now the main causes of hepatitis are viral hepatitis. Now these viral hepatitis are basically infections which are gained from some source. So there are few infections which are acquired from food and water contamination like hepatitis A, E, and of course there are other infections which are spread through blood like hepatitis B, C, D, which can be transmitted just like HIV is transmitted through sharing of needles, through blood transfusions from mother to child and unsafe sexual practices. And this can cause hepatitis B and C, which are chronic hepatitis. In most cases, hepatitis A, E are self-limiting. Maintaining proper health and hygiene, proper food and water hygiene can prevent infections with hepatitis A and E. Once they do happen, they're usually self-limiting and don't need too much medication but need proper monitoring. So you must consult with a doctor whenever you have this hepatitis A and E. Patients can develop jaundice, they can have some fever and they can have nausea, loss of appetite, and this can resolve over a period of 1 to 2 months. There can be weight loss as well. Hepatitis B and C are something which is called chronic hepatitis. So this sort of hepatitis can last for years, even lifelong. So these hepatitis, of course, you can prevent through maintaining safe sexual practices, not sharing needles, not indulging in the kind of behaviors which can cause infection through blood. Now proper screening can be done, and of course for hepatitis B we have good vaccine available which is protective in nearly all cases which have been completely vaccinated. Hepatitis C, though it does not have a vaccine, there is effective treatment available now for the past 5 to 7 years which can completely cure the disease hepatitis C in almost all cases with just a 3-month to 6-month course of medications. Now, for these patients who have chronic hepatitis, the risk is that they may develop liver cirrhosis and which can turn into liver cancer and liver failure. This is why we need to prevent these two infections as well. Apart from that, there is an entity called alcoholic hepatitis. This happens because of consumption of alcohol, which forms toxins and causes damage to the liver. These toxins, when they damage the liver, can result in liver cirrhosis and can cause liver damage and liver failure. The prevention is just not taking alcohol. Once the hepatitis does turn into cirrhosis, unfortunately, there is not much we can do to reverse it completely. So prevention is the cure here in these cases. Apart from that, there is an entity called non-alcoholic fatty liver disease. It is now known as non-alcoholic steatohepatitis, NASH. Now there is increase in the fat content of the liver. This fat causes gradual damage to the liver, which can ultimately turn into cirrhosis and liver failure. Unfortunately, this sort of hepatitis is now on the rise. Because of unabated obesity and the pandemic of diabetes in the world, fatty liver disease keeps on increasing. And we are getting more and more patients of fatty liver induced liver cirrhosis, liver failure and damage. You have to understand, for such cases, the main treatment is weight loss. Timely, healthy lifestyle, maintaining a healthy diet, body weight, and losing weight if it is excessive can get rid of this fatty liver hepatitis, and you may not develop cirrhosis in such cases. Apart from that, there are other entities like autoimmune hepatitis, where the liver gets damaged due to cellular damage by the body's own cells and the body's own immunity. This, of course, has to be treated by a professional, and it's an entity which you cannot control. There are unknown factors at play here, which on which research is still going on. Apart from that, certain drugs and medications can unfortunately cause hepatitis, and we must avoid unnecessary drugs and unnecessary medications at all costs. Apart from that, there is an entity, rare entities of Wilson's disease and other diseases which can cause hepatitis with or because of rare diseases. So in Wilson's disease, there is an increase in copper in the liver which can cause liver damage. Now, hepatitis can turn into liver cirrhosis. Cirrhosis means there is scarring of the liver. Just like when the hand gets cut or skin gets cut and there is scarring of the tissue there, whenever the liver gets damaged, it can turn into liver cirrhosis. When the liver gets scarred enough, the functions of the liver stop and the patient can develop symptoms like jaundice, swelling of the abdomen by accumulation of water in the abdomen. There can be blood vomiting or passage of blood in the stool. There can be decrease in protein, the patient might start losing weight, and they can be bleeding from other sites in the body. The patient can also become altered. That means they're not able to function properly. They can become drowsy, not able to respond properly to talk, and they can even become comatose. So it is very important to understand that we need to prevent this cirrhosis from happening, because once cirrhosis is already set in and it is advanced, there are very few treatments which can reverse this cirrhosis and cause complete resolution. Now, a certain percentage of patients who develop cirrhosis can ultimately go on to liver cancer as well. And unfortunately, the treatments for liver cancer are few, and if not caught in the early stages, it is fatal in most cases. So prevention is the cure for all forms of hepatitis. But yes, even if you develop hepatitis, please realize that we have good treatments available now which can help you lead a healthy and normal life. It is important for all people to maintain a healthy diet, a healthy body weight, exercise daily, drink plenty of water, eat nutritious, vitamin-rich and mineral-rich foods and fruits with good amount of fiber, avoid alcohol, toxins, unnecessary medications, avoid unsafe practices, have a clean and hygienic food and water intake, and take your vaccines at regular intervals. Especially hepatitis B vaccine should be taken by all, because it's a very simple method. Only 3 doses are required and you can be completely safe from this deadly disease. Remember, prevention is the cure for hepatitis. Thank you.